resume. Thank you all for joining us today. If you've attended these town hall events before, you know we've been hosting these quarterly events in partnership with Illinois Department of Public Health over the past year on issues related or highlighting emerging issues that have come about related to the COVID-19 pandemic. And today we'll be hearing from presenters on how Medicaid health plans are supporting pregnant and postpartum people. And so this includes an overview of IMHIP, the Illinois Association of Medicaid Health Plans, Maternal Health Toolkit, and then we'll also be hearing from County Care, which is a health plan here in Cook County that serves Chicago residents about their specific maternal health programming. Nope, sorry. For those who don't know anything about EverThrive Illinois, for more than 30 years, we've been advancing the health and safety of Illinoisans by supporting access to quality health care and providing resources to achieve health equity. Our aim is to affirm and center the experiences and voices of communities most impacted by injustice to achieve reproductive justice for all people and families, especially those in Black, Brown, Indigenous, and LGBTQIA communities. We ensure that folks have access, resources, and healthcare necessary to create and sustain healthy families on their own terms. A couple of quick housekeeping things before we jump into the agenda. If folks could keep yourselves muted to reduce background noise. We'll send a follow-up email with materials to everyone that registered today. And please feel free to type questions into the chat box as we go. We'll have 2 Q&A periods after each presentation today, and we'll circle back to questions during those time periods. And so our agenda for today is starting with these introductions now. Then, as I mentioned, we'll have Tricia Rodriguez presenting from the Illinois Association of Medicaid Health Plans, also known as IMHIP, on their maternal health toolkit. Then we'll have a presentation on County Care's maternal health programming from Emily Lupo, Ananya Stoller, and Maeve Dixon. And then we'll wrap up with some resource sharing and an evaluation at the end. So before I kick it over to Tricia, I'll just introduce her. As Director of Public Policy and Government Relations, Tricia leads IMHIP's work on executing legislative strategies, formulating healthcare policy that enhances the Medicaid experience for consumers, and developing best practices for improving health plan operations, healthcare quality, and accessibility. Prior to joining the association, Tricia was a policy and budget analyst for the Illinois Senate with 3 years of experience working on various legislative initiatives related to public health and the Medicaid program. And Tricia earned her bachelor's degree in political science with a minor in business from the University of Illinois at Urbana-Champaign. So I will stop sharing my screen now, Tricia, and kick it over to you.
Perfect. Hello, everyone. Thank you so much to EverThrive for the opportunity to present today. Again, my name is Tricia Rodriguez. I'm the Director of Public Policy and Government Relations at the Illinois Association of Medicaid Health Plans, or as we like to affectionately call it, IMHIP. I'm going to go ahead and share my screen for a little bit of intro, and then we will get straight into the maternal health toolkit. Can everyone see my screen?
Perfect.
Yeah. So just to start out with, who is IMHIP? We are a member organization that represents the entire Medicaid managed care industry, which is very unique. I think Illinois is, if not the only state, one of the only states that has its own trade association for the Medicaid health plans. Normally, the Medicaid health plans are kind of looped into the commercial trade association, so that's a little bit unique. We work with the Illinois state government, legislators, advocacy groups, other trade associations representing providers, and Medicaid members to invest in and provide high quality healthcare that is focused on cost-effective, individualized care that helps the residents of Illinois live longer and healthier lives. And this just shows you our membership for 2022. For Health Choice, which is the Medicaid only population, we have Aetna, Blue Cross, County Care, which we're lucky to have them join us today. We have Meridian and Molina. For MMAI, which is the dual eligible, it's people who are eligible for Medicaid and Medicare. We have, basically the same slate of plans, Aetna, Blue Cross, we have Humana, which is unique for the MMAI space. And then we also have Meridian and Molina. And then also kind of a new health plan in the last couple of years for the DCFS population is Youth Care, and that is owned by Meridian. I'm going to stop sharing for a second so that I can pull up the next. All right, so getting into the toolkit. Can everybody see this? Perfect. So this is our maternal health toolkit for providers. I will say we're working with a group called the Fetal Infant Mortality Review Study on a consumer-facing maternal health toolkit. So that will be available in the coming months. We'll be adding some additional items to this, as well as kind of working on the reading level to make sure that it's accessible to everyone. This is kind of just table of contents, what we're going to be going over today. And we're starting out with the actual maternal health benefits that are covered under the Medicaid program. Many of you probably already know this, but the Medicaid program in Illinois covers about half of births. We focus on vulnerable and disadvantaged families. In Illinois, the maternal health benefit is pretty comprehensive, as you can see from the services that are listed on this page. Medicaid in Illinois covers family planning services, which we'll get into more in depth later on. It covers prenatal care visits. One item that I did want to note here, IMHIP worked on legislation this past session to increase the prenatal care rate for providers. It's actually doubling the rate from where it was previously. So we are hoping once that takes effect, we see, kind of a higher rate of people getting to those prenatal care visits. Obviously covers labor and delivery, also covers the postpartum care appointments. And there is a little bit of a change that was recently implemented with that. Originally, Medicaid just covered the one postpartum visit, but now it covers two, one within the first 3 weeks, and then an additional visit between 4 and 12 weeks. So that is really positive progress. Medicaid also covers breastfeeding education and lactation counseling, blood pressure cuffs, which we'll get into a little bit more, any emergency services that pregnant people might need, prescription drugs, help to quit smoking if that's something that a member needs, and then therapy and mental health and substance use disorder treatment, which will, kind of go through the comprehensive benefits there. One of the other things to note in the last couple of years, Illinois was the first state to extend postpartum Medicaid coverage from 60 days after childbirth to a full year, which I think is really amazing. I don't think that has been technically implemented yet because during the public health emergency, we aren't doing redeterminations anyway, but kind of once that is shut off, this policy will go into effect to make sure that people have the wraparound coverage that they need. For any providers who might be on the call who are interested in, how to bill for these types of services, IMHIP does have a comprehensive billing manual. Again, very unique for the industry. I don't think there's another one of these across the country, but it does provide specific guidance to providers on how to bill for anything, but maternal health services are in there, especially family planning, LARCs, and things of that nature. And it is linked on this page in case you need to use it. Moving on to the blood pressure monitoring kits, these are a very effective tool for monitoring and supporting pregnant people in between their appointments. One thing to note, this is a benefit that is covered under Medicaid. There's no additional cost. There is some guidance here on how to request a blood pressure cuff. And also, if your member has already received one of these kits, but they need a replacement, you can contact your health plan and get that replacement for them. I also wanted to share our guidance related to hysterectomy and sterilization services. Prior to performing any of these services, you do have to have a form signed by a Medicaid member and their physician. And this memo just goes through kind of some of the common mistakes on these forms. Partially, you want to make sure that you're filling the forms out in their entirety, and then you want to make sure that they're being signed by the patient and the physician and dated no later than the date of the surgery. Kind of following some of IMHIP's work this legislative session on prenatal and postpartum visits, I wanted to really kind of share some of the best practices here. Attending prenatal and postpartum care appointments is still a significant, there's still a significant gap for the Medicaid population. They face a lot of unique barriers. According to new data from HFS in their 2022 perinatal report, about 20% of those in the Illinois Medicaid program did not receive timely access to prenatal and postpartum care. And obviously, we know getting to those appointments timely is one of the best ways to improve the chances of a healthy pregnancy. So we definitely want to be incentivizing providers to follow up and make sure that members get those appointments and they keep them. I did just kind of want to go through the current ACOG recommendations for prenatal and postpartum care appointments. The guidelines are for an uncomplicated first pregnancy. You'll want to go to a visit every 4 weeks for the first 28 weeks, every 2 weeks until the 36-week mark. And then after that, you want to be going weekly until delivery. If you're over 35 or you have a chronic health condition, you're going to want to check in with your doctor, see if more frequent visits are necessary, make sure you're discussing your health history with them and making a plan for managing any complications. For postpartum care appointments, which are equally important, Illinois, they're currently allowing billing in line with these ACOG guidelines, which is an initial postpartum appointment within 3 weeks, and then that second postpartum appointment between 4 and 12 weeks. And the 2 postpartum visits did go into effect October 8th of 2021. So you should be able to bill for that second visit today. Another key best practice that I wanted to mention is just making sure that there's adequate communication and information sharing between providers and pregnant people, especially when a Medicaid member is talking about any complications that they may have. Providers want to make sure that you're actively listening, taking concerns seriously, and engaging in shared decision making to the extent possible. I wanted to share a little bit more about the family planning services that are available under the Illinois Medicaid program. As you can see from this list, again, it's pretty comprehensive. Access to these services just kind of helps Medicaid members achieve, their desired family size, and it also improves health outcomes for pregnant people and their children. And to get into what benefits are covered, you can see here a reproductive life plan, education and counseling on all contraceptive methods, all of the contraceptive methods, including over-the-counter and prescription emergency contraception, permanent methods of birth control, basic infertility counseling is covered, although the actual medications and procedures are not covered at this time. a reproductive health exam, any STI or STD testing, HIV testing and counseling, lab tests, cervical cancer, and other, reproductive related cancer screenings, HPV vaccine and screenings, and then mammography as well. I did want to mention, also due to some legislation passed in 2021, Medicaid members with incomes at or below 208 of the federal poverty line will now be eligible for family planning services. That is effective December 1st of this year, and presumptive eligibility will also be implemented for these services. So I think that is an amazing step forward. Obviously, when you're talking to Medicaid members about their family planning options, you want to make sure to continue to assess their needs, talk to them about all of their options. And for people who are pregnant, you may want to talk to them about a medium postpartum LARC option if it's appropriate for them. Getting into some of the additional benefits that our Medicaid managed care plans provide, I think one of the really unique benefits of the Medicaid managed care program is we're able to kind of go above and beyond what is a traditional Medicaid benefit. So you can see here from the chart, our health plans also cover things like gift cards for attending prenatal and postpartum care appointments. You can get a free car seat as an incentive, packages of diapers, portable cribs, things of that nature. And you can see all of that here. I did include the link to the HFS website, to compare each of the plans, because it kind of lists all of the additional benefits in case you're interested. But these are just kind of the maternal health related ones. Depression and anxiety is something that affects a significant number of pregnant people who are on Medicaid. IDPH, in their most recent maternal mortality and morbidity report, they named mental health, including substance use disorders, as one of the leading causes of pregnancy-related deaths. So it's very, very serious. You can see here what all mental health benefits are covered under Medicaid. Mental health assessments, which part of that legislation that passed in 2021 is coverage of perinatal depression screenings up to 12 months after childbirth. So that's really positive. Case management is also covered, crisis intervention, mental health intensive outpatient, rehab, any prescription drugs that may be used to treat mental health or substance use disorder, therapy, and then detox services. And then, beyond just what is a covered benefit, I did also want to share some resources below that might be helpful to pregnant people who are actually going through a mental health or substance use concern. There is the Perinatal Depression Moms Line, Postpartum Depression Alliance of Illinois, and then to find actual treatment for substance use disorder, there is a website run by DHS, which actually we didn't know about until some legislation that we worked on this past year. But you can actually go on the Illinois Helpline website and type in your location and what kind of services that you're looking for, and it'll show you what facilities are available. And in many cases, it'll show you how many beds are available. Transportation is another benefit covered under the Illinois Medicaid program. I do want to note one recent change that happened is for non-emergency ambulance that has been carved out of managed care. So now it is back with HFS under the fee-for-service program. So if you have a Medicaid member who is requesting non-emergency ambulance, you will want to instruct them to call First Transit. They will call First Transit. First Transit will provide a list of phone numbers for the member to call. And then, the member will kind of be responsible for coordinating their care in that way. But for all other levels of service, such as a medic car or a stretcher van or anything like that, The phone numbers and websites are listed here for members or providers who are needing to call to get a ride. And we do have a more comprehensive transportation toolkit that was created for providers. There is a link on this page, and that just kind of goes through some of the scheduling policies as well that members may want to be aware of. And that is all I have. Any questions? I know that was a lot.
Thanks so much, Trisha. If anyone has any questions, feel free to either put them in the chat, or we also can unmute you if you want to ask them.
Hello, my name is Toyin, the manager for the SSFB team for Meridian at St. Sorry, I had a little problem logging in. Thanks for the great presentation. There's a lot of opportunities for members. One question that I need to ask is just the last one that you said, not emergency ambulance, that they should call a first transit. And that what do you mean by member will be responsible for coordinating their care? Is it just providing them with the number and then they follow up on their own, even if they have issues? You know, how do we jump into this when they are responsible for coordinating their care?
Yeah, unfortunately, that is kind of one of the things that has happened with this transition. When non-emergency ambulance was under managed care, the member's care coordinator would be responsible for identifying transportation options and calling on the member's behalf. But unfortunately, HFS under the fee-for-service program, they do not have any care coordinators. They only have a prior authorization vendor, which is First Transit. And so they were not able to secure, a vendor for this transition that can actually help the member make those phone calls. And so, the member will call First Transit, they will get a list of, 4 to 5 phone numbers. It's the member's responsibility to coordinate their care in the sense that they are the ones calling, and then they need to call First Transit back to let them know whether they were able to secure a ride or not. So obviously, not something that we agree with. We want to make sure that the Medicaid member, has help throughout the process, that it's a seamless process, it's not confusing in any way, but HFS just does have that limitation. The MCOs have been supporting where necessary, where certain cases need to be escalated. Members can't find rides on their own, but yeah, there is that limitation under the fee-for-service system.
Okay, thank you.
Hi, my name is Joanne. I have a question. I did put it in the chat, but are doula support services for postpartum covered at all? There's a program where we're going to be having doulas provide postpartum support for up to a year. And I was just wondering if any of those services are available. And also, how can we get a copy of this report that you just spoke of? Thank you.
Yeah, thank you for that question. So HFS is still very much in the planning phases of, covering doulas and home visiting. That is my understanding. They had a public comment period several months ago, and I haven't heard anything from them since then. It will be a covered service at some point, but I'm just not sure at this time when that will be. But we are continuing to monitor that, and we'll be ready to cover it once it is a covered service. And with regard to how to access the maternal health toolkit, it's actually on our website. I will pull the link for you guys and put it in the chat so you have it.
Thank you.
We'll also share out with the recording and slides a link to the toolkit afterwards, just so everyone has it via email as well. Okay, well, if there are no more immediate questions for Trisha, if folks think of them while the next folks are going through the presentation, please feel free to just continue to put your questions in the chat box. So I'll briefly share my screen again as we turn it over to the folks at County Care to present. So Maeve Dixon, MPH, is the Senior Manager of Policy and Innovation at County Care, where she monitors federal and state Medicaid and Medicare policy landscapes through proactive advocacy and the tracking and implementation of legislation for the health plan. Maeve has over 6 years of experience in public health and maternal and child health. Maeve has previous experience in the field of reproductive health, working for Planned Parenthood of Michigan, and most recently served as program manager in County Care's Clinical Services Department, providing oversight of the health plan's care management program. Maeve completed her master's in public health with concentrations in maternal and child health and community health at the UIC School of Public Health Center of Excellence in Maternal and Child Health. We also have Emily Lupo, MHA, is the manager of population and performance improvement at County Care, where she is responsible for the development, implementation of, and reporting on quality programs and initiatives designed to positively impact member outcomes and experience. Emily has more than 10 years of experience working with Medicaid members in Cook County. And prior to her current role, she served as the Director of Population Health for Lawndale Christian Health Center, where she was responsible for population health, quality improvement, and population-specific programming, including for the maternal and child health population. Emily completed her Master's of Healthcare Administration at UIC School of Public Health. And then finally from County Care, we have Ananya Stoller, MPH, who is the Maternal and Child Health Program Manager at County Care, where she oversees MCH-related initiatives and designs new programs to improve the health of members. Ananya has over 7 years of experience in project management and has worked in the payer space as well as in health equity. She holds a project management professional credential, and Ananya completed her master's in public health also at the UIC School of Public Health, where she studied MCH epidemiology. So now these folks are going to chat about how specifically County Care, that specific health plan, again, that serves folks here in Cook County and Chicago, the types of MCH programming that they have. So I'll stop sharing my screen now and turn it over to you all.
Thank you, Kristen. I'm going to pull up our presentation. And get us into presentation mode. Can someone confirm that they can see the slides?
Yes, we can.
Thank you. So for our presentation today, we're going to be giving a very brief overview of County Care and some data specific to our maternal child health population. We're going to share some of the services and benefits we have for this group of members, and also talk about some initiatives and resources that we have. I'm going to start with a very brief overview of County Care. So currently there are over 2.7 million Illinois residents that are covered by Medicaid. County Care serves well over 400,000 of those members in Cook County. County Care only serves Cook County residents and is the only Cook County specific plan. And I'm going to let Ananya talk a little bit about our maternal child health population.
Thank you, Emily. So here we have a member profile by age and gender. So the blue bars represent female members and the orange bars are male members. So you can see the majority of the membership does fall between 6 and 64, but we do have a good number of infants and young children as well. And might be a little hard to tell from this chart, but we have more female members than male, so roughly 55% female. Next slide, please. So this is looking at our pregnant members among women of reproductive age. So we have roughly 3,500 pregnant members at this time out of 125,000 roughly women of reproductive age among our membership, and that comes out to about 3% of the women of reproductive age are currently pregnant. Lastly, I wanted to share that we do have a large percent of pregnant members living in disproportionately impacted areas. If you look at this pie chart, the orange is actually the pregnant members that are currently living in these DIA designated zip codes. So it's 80% at this time of County Care's pregnant members live in these disproportionately impacted areas.
All right, thanks, Ananya. All right, so I'm going to get into some of our unique County Care rewards and benefits. Trisha talked about this kind of at a high level from all of the health plans. This will be specific to County Care. Okay, so we have a lot of really exciting rewards and benefits for pregnant people, families, and children. So on the left here, you'll see our rewards. On the right, you'll see our benefits. Rewards are, I'll talk about our OTC card, but these are rewards that automatically get loaded on a card that gets mailed to the member and can be used at a lot of different stores in Cook County, like, like your Walgreens, Jewel, things like that. So you can see listed here, there's different amounts of money that are loaded on that card for different visits. So each prenatal visit, members will get $10. We have a reward for attending a postpartum visit, and then rewards specific to children. So $50 for going to a baby's 1-month checkup, $10 for up to 5 well-baby visits, and then $10 per childhood immunization. So we're always kind of refining those, and we may add additional ones, but those are our current rewards for our pregnant members and our families. On the right here, you'll see benefits. So these are more like physical objects that that members can get. So we do have a free car seat. There's no like visit requirement or anything tied to that. So members can call member services and have that free car seat delivered to them. We mail monthly diaper coupons to our members with children. So for each child, we'll get a monthly diaper coupon for a free pack of diapers from Jewel. We also have a portable crib and a sleep safe kit. This is now actually, I think, 4 prenatal visits, not 7 anymore. So if a member attends 4 prenatal visits, they're eligible for this portable crib and sleep safe kit, and they would call member services to receive that. And we have a book club that we really love to promote. So children can receive 1 free book 4 times a year. At a certain age, kids also get a Target gift card when they're in part of our book club. That also can be accessed through calling our member services, and we'll share phone numbers at the end of the presentation. So like I said, just to emphasize, oh, sorry. I can keep going. Those rewards are automatically going to be added to a member's card, and diaper coupons automatically get mailed to the member. Those other benefits would need the member to call in to member services to request that benefit. The next slide is just a little more information on that OTC card. So I think I went over most of this, but in the right, you can see what that looks like. It will get automatically money loaded on it and mailed to a member when they attend a visit that's eligible. Some of the stores are listed here. And there's also an app that is associated, so a member could check their balance, figure out what items are eligible, what stores they can go to with that card. All right, Trisha talked about some of these as well, but we wanted to highlight some of the durable medical equipment that is covered through Medicaid and County Care covers. We cover a double electric breast pump, a blood pressure cuff, and thermometer. Those 3 can all be ordered through a provider. So the provider would need to place that order, and that equipment would be sent to the member. We think, these are really great items to have, especially as we're still in the pandemic. Having those items at home is really important. And then our member services, members can call there and have a home pregnancy test delivered 1 time a month. And we cover much more durable medical equipment, and that information's on our website, but these are just a few we wanted to highlight. We also cover a lot of different provider options and locations for prenatal care through children's healthcare. So on the prenatal care end, members can see an OB-GYN. They can also see a midwife. We have many maternal fetal medicine specialists in our network, dentists, and behavioral health and substance use providers as well. In terms of where members can give birth, we cover births in a hospital, at birth centers, and Medicaid also covers home births. So that's an option that some people will want to explore. In terms of infant health, we cover, the full range. Pediatricians, specialists, pediatric dentistry, and NICU care are all in our network. And then for postpartum care, we connect moms back to their primary care provider to restart that primary care. We continue to cover behavioral health and substance use and many other specialists. I encourage folks to, use our Find a Provider tool, which is linked here and on our website, where you can find a provider by provider type. And we also, in the past year, developed a guide for how to find a midwife. We really want to emphasize midwifery care as an option for our members. And if we go to the next slide, it can give you sort of a preview of what that looks like. But you've got the link there. So we give just a little bit of background information on what is a midwife, what does midwifery care look like if a member chooses that for their prenatal care, and then help finding it. So I know it can be kind of confusing. So we list all the clinics in our network, our different FQHCs that have midwives who offer prenatal care. And then we also show what that partner delivery hospital or hospitals are and give the phone number. So we really want to emphasize this as an option for members that's in our network. And this is, really hot off the press Friday, we wanted to add in a slide about Medicaid coverage of abortion services in Illinois because, we really think members are going to have questions about this. And so we want to be, we want to have that information ready. So we want our members to know and our providers to know that Illinois is a freedom of choice state. Illinois passed legislation. There's a state law securing the right to all reproductive care, including abortion for Illinois residents. This law remains in place despite Roe being overturned. So we would encourage members who are in need of abortion services to talk to their PCP or their OB-GYN as a next step to get more information on accessing that service. Medicaid does cover abortion in Illinois, but it is carved out of the MCOs. So this is more for providers, just on the billing end. This abortion gets billed to the state rather than to the MCOs, but it is a covered service that members would access using that HFS medical card. And Tricia spoke to this, but just again, to emphasize, Illinois Medicaid covers a full range of reproductive health services, including pregnancy care, prenatal care, maternity care, and family planning care. I listed a few links here. The first is a provider notice that Illinois has put out when the draft opinion was leaked that has really more specific billing guidelines for providers on how to bill this service. I listed the piece of legislation here that protects the right to abortion in Illinois, and our county care member handbook, which if members were looking for information on this, they would see, that it's covered, but it's covered through state Medicaid rather than the MCOs. So please let us know if you have questions. We're going to be communicating information out to members on this as well. Our call center is going to be educated, care managers. So we want to make sure that members have information when they have questions about this. And transportation, Tricia spoke to this as well, but I have the number here for First Transit that can help connect members to transportation services. Members who are going to Cook County Health for visits can use the Cook County Health fleet. They have a fleet of vans, so that phone number is there. We provide bus and train passes, so members, if they know they have an appointment, call member services, they'll get a CTA pass mailed to them that they can use. And then medical homes, specific medical homes do partner sometimes with like Uber or Lyft. And so we encourage members to also call their provider to see if their medical home has additional transportation services available. All right, I think that's it for me. I'm going to turn it back over to Emily.
Thanks, Maeve. County Care has many maternal child health initiatives. We're choosing to highlight 2 specific initiatives. The first of which is our Maternal Child Health Performance Improvement Work Group. The purpose of this work group is really to drive quality and performance improvement for this population, supporting excellent care and excellent member experience and health equity. This work group really does a good job of tracking HEDIS metrics related to care for this population, analyzing gaps, and then planning initiatives that really target the barriers to care. Some examples of initiatives that this group has worked on include that How to Find a Midwife guide Maeve highlighted a few moments ago, as well as enhanced care coordination for pregnant members, creation of a wide variety of member and website materials, promoting diversity and inclusion among our maternal child health providers and the County Care Network, and also supporting a number of policy changes and advocacy for this specific population. The second initiative we'd like to highlight is our prenatal care performance improvement project. The goal is really aimed at increasing timely linkage in the first trimester to prenatal care for all of our pregnant members. Interventions aimed at accomplishing that goal include figuring out how to improve how we identify pregnant members in a timely manner, and then increasing the care coordination, outreach, and support early in the pregnancy to make sure that they're linked to quality care as early as possible. Additionally, we're streamlining some linkage options for prenatal care providers in our network, trying to facilitate options for same day or next day prenatal care appointments. Interventions will be prioritized for members residing in specific regions. As Ananya highlighted, a high percentage of our pregnant members reside in disproportionately impacted areas. And so equity is a significant focus of this project as well. We're really trying to focus on those areas where historically there have been lower rates of timely prenatal care linkage. We do have a number of web links here, as well as important phone numbers for reaching some of the County Care specific resources. Our County Care website, as well as the member benefits and rewards pages are linked. The Find a Provider tool and How to Find a Midwife guide are linked earlier in the presentation as well. And then there's a number of phone numbers here that could be helpful if folks on the webinar today support County Care members. Anything from member services, benefits questions, links to care coordination, or the nurse line support, as well as behavioral health resources. All those resources and numbers can be found here. And we also included our contact information in the slides as well. We'd be happy to pause and take any questions if there are any.
Are you able to go back? I was just getting some of those phone numbers. Will we have access, especially that nurse line resource? Because so many of the patients, I'm a nurse, and they call me, but sometimes I don't have the answers when it's specific. So I just want to get some of those phone numbers. Thank you.
You're welcome.
And I saw a question if this is only for people who live in Cook County. So County Care Health Plan is only available, is an MCO that's only available for Cook County residents, but MCOs, other MCOs are statewide, and all MCOs will have some maternal child health specific benefits, rewards. But yes, County Care is just for Cook County residents.
Good question. Thanks, Maeve, for catching that in the chat.
The other thing I just realized we didn't have a slide on it, but we have the phone number here. Just wanted to emphasize, we also have a really large care coordination program. And so there's a phone number here. If a member is pregnant and wanted to be connected to a care manager who would work with them throughout their pregnancy, through the postpartum period, they can call that phone number and ask to be connected with a care manager, a care coordinator. So that's just another service that's available.
I have my hand up. I don't think you see it. So hi, Maeve and Ananya. I just curious about dissemination of your information. I promote is Illinois is trying to figure out all the things that pregnant and birthing persons need to know and the best ways to get this information out to people. You have the advantage of that, you know, your care plan sends stuff out, but just curious as to how people get this information and what are the ways you're considering to make sure that really people actually get it. And I know Kristen's on the call too, and this is an ongoing discussion in our communications committee of I Promote, because trying to figure out, there's all these changes in policy, and then there's all these different benefits, and there's all these different plans, and it's just a really confusing maze out there. And just so curious about your communication strategy.
That's a great question. Emily and Anya, I'll take a first pass, but feel free to jump in. So one thing I would highlight is we do have a pretty robust like text message program for our members. And we have I don't know what the word how to use, but we have like a series of text messages that we send to all people of reproductive age, and they can opt into them if they want more information. And we get like a 50% opt-in rate, which apparently is very high. So it's one of our most successful text message campaigns. We find that folks really want that information. So once they opt in, they'll get every once in a while text messages that give them information on our benefits and our rewards, give them resources, links to, you know, website or phone numbers. And we find that we have good engagement with that. We also have a page, we just revamped it on our website that's specific to like everything maternal and child health. So all of this information is on that web page. And then certainly through our care managers as well, also have lots of information and have a lot of like direct contact with members. But Emily and Anya, anything I'm missing?
I would add our care managers get printed copies of some of the Brighter Beginnings materials, which can link them back to our website and can outline certainly some of the benefits and rewards. The other major change this year that we made in regards to communication is there's a Brighter Beginnings brochure that's added to all new member packets. So any person in a family with children that is a new enrollee to County Care will receive that introductory information. And I think that's part of the reason for the strong uptake in some of our Brighter Beginnings text message campaigns, because it's already familiar to them.
Thank you.
Kind of have a question, piggybacking off of Dr. Handler, as far as with the dissemination and how communication is sent to families. So I know you all said you send text messages to people about the rewards and benefits and things of that nature. Do you all, or have you all considered doing something where it's kind of like some reminder kind of like texts, or if you have a person of reproductive age and let's say they are pregnant, that maybe helps and support them into kind of staying on the right track with, hey, you have a prenatal appointment you should be scheduling or coming up with soon, or it's time to schedule your postpartum checkup, just kind of like something that, you know, it may not be able to be catered specifically to everyone, but kind of just like kind of a way to support people with keeping it in mind and knowing like hey, it's time for me to act on this.
Yeah, I can take a first pass at that one. We actually have thought about that. And I think part of our prenatal care performance improvement project is improving the data sets we have available in a timely manner to be able to do that. So having a very accurate data set of who is pregnant as early in the pregnancy as possible is kind of the first step to some of those more automated, targeted text messages early in pregnancy. Certainly we could move on the postpartum visit reminders earlier. I think we've always wanted to be cognizant of every member's individual outcomes, and sometimes delivery does not, sometimes it's not a happy thing. So trying to be sensitive, but I think we certainly have started thinking through that as part of our performance improvement work group.
I was gonna say, I think there was one more question in the chat just about what documentation requirements there are specifically for like county care and these services. I'm assuming they're probably maybe different depending on what service they're trying to seek.
Documentation requirements. So for the benefits and rewards, if it was to require like visits, we're tracking that on our end. So we can know if someone's eligible, but the member would really, so they'll automatically get, you know, rewards on their card. They don't need to take action on that. If they want to know if they're eligible for, you know, something like the crib, they could call member services and we'd be able to identify if they met that requirement. But if there's something else about documentation that you're curious about, if you could either, you know, come off mute or type it in the chat, I can help answer that.
I think the only benefit that requires like a signed consent at this point is the Sleep Safe kit. The rest are fairly easy sign up, and the rewards, as Maeve said, are automatic. I will turn it back to Trisha unless there are any additional questions.
Hello, I'm sorry. This is Twain again. Is your text messages, is it done by maybe a vendor, the campaign that you were talking about, or is it something that is internal? Is it?
We use a vendor for our text messaging. Mm-hmm.
Okay, gotcha. Okay.
Hi, Rachel. If you can unmute, yep, it looks like you're unmuted.
Yes. So my question is, I know we were just talking about the car seat and the crib. I know you said that there's not like a visit requirement, but is there a certain time frame they need to order by or sign up for those items? I know some insurance providers, you have to kind of opt into that earlier into the pregnancy to be eligible. So I just want to know, what are your restrictions on those programs?
I don't think there are restrictions with the car seat, but I can take that back to our member retention team. For the crib, it does require 4 prenatal visits and a consent signature. But as long, you know, within that time frame, if those visits are met, I think it's flexible.
Awesome. Thank you so much.
Logistically, earlier is better. There is some time for processing and shipping. Yeah. I'm not sure if that was part of your question too.
Yeah, absolutely. And yeah, I think earlier is better, but sometimes I'm a case manager and unfortunately we don't find out what's needed until much later. So I just want to know that in advance.
Mm-hmm. And if there's a specific situation, you know, we can always escalate and make sure members get what they need if it's a unique situation.
Awesome. Thank you so much.
Hi, Sarah, you can unmute yourself. I see your hands up.
Yeah, thank you. Yeah, thank you for this presentation. It's really interesting and exciting to hear some of the initiatives. I was just curious with the Brighter Beginnings that if you have access to any data regarding program evaluation for the Brighter Beginnings initiative, or just to understand how it's being accessed, if you see any trends, like when people drop off, because again, it sounds like a really, really great program.
Maeve, do you want to speak to
I
it?
wasn't sure if you were. Yes, we are in the process of doing a pretty big evaluation right now, and we're so happy to have Ananya here, who has an epidemiology background, to help us with our data. So we're really digging into who's using these rewards, who's accessing them, who isn't, what are the barriers to receiving them, so that we can make changes to make sure that it's really accessible and people are getting what they need. But feel free, Emily or Nanya, to add anything I missed.
Yeah, I would just echo, we're in process. We have also looked at website traffic on our Brighter Beginnings page, and it is largely what you would expect, reproductive age women.
Yeah. Oh, thank you.
It looked like there was one final question in the chat box. So what's the turnaround, probably average turnaround time when clients order items once the order's placed?
Yeah, I think that varies. I would emphasize again, ordering earlier is better. I know there's of course supply chain issues that have impacted, like getting a car seat delivered. But I would put it at like certainly more than like 1 week, like multiple weeks may be needed. So just keeping that in mind, and that could be longer depending on supply chain.
And that's part of the reason, as Maeve said, we shortened the requirement from 7 prenatal visits required to 4. So we definitely, our operations team is tracking that closely to make sure that members can still get all of these great benefits prior to delivery.
Great. Well, thank you to all of our presenters so much for your presentation. I just have a couple of resource and wrap up slides before we end today. Oh, is someone chatting? No. Okay. So folks, especially if you've attended, I'll go briefly again through IMHIP's material. So I have a link. If someone's not muted. Okay, there we go. I put a link to IMHIP's maternal health toolkit here. And again, we'll send out these slides so you all will have access to these links. Also a link to the MCO transportation toolkit, which I had put a note, Tricia mentioned earlier, that they're working with FEMR, the Fetal Infant Mortality Review Committee, to create a more consumer-facing resources that you could then share with the clients or folks that you're seeing. And it sounds like also the maternal health toolkit more consumer-facing as well. So I know those will be coming out soon. Just again, we spent a lot of time on this slide, all the context for county care if folks need it. And again, we'll send this out. And if you've attended the town halls before, we've been sharing more information about EverThrive Illinois' Healthy Choices, Healthy Futures Perinatal Education Toolkit that we launched last year, which includes reliable evidence-based tool and resources to support individuals during their reproductive years. So it's really meant to support health and social service providers to ensure that folks across Illinois, regardless of where they are in their reproductive journey, are able to make informed health decisions before, during, and after pregnancy. So it's broken up into the pre and interconception, prenatal and postpartum periods, and is just a compilation of resources, kind of a one-stop shop where you can find information on a variety of topics, whether it's nutrition during pregnancy, postpartum mental health care, anything you would kind of need or want to know about during the reproductive lifespan or reproductive years to help the folks that you're serving. And so we also just launched an evaluation of the toolkit because we want to hear feedback on how folks are using the toolkit, whether it's helpful, how we can improve it. So I've included a link here. on the slide. The survey is anonymous, confidential. We are providing raffles with gift cards as incentive for folks to fill out the survey. It's only about 8 minutes to complete if folks have some time. And we actually also have some focus groups that we're doing as well related to the toolkit this Wednesday, and we have a couple of spaces left. So the first one in the morning is going to be for social service or healthcare providers. And the one in the afternoon is going to be just for community members or folks who maybe don't necessarily work with pregnant or postpartum people, but have used the toolkit themselves or interacted with the toolkit in some way and want to provide feedback on, again, kind of how you're using the toolkit, how we can improve it, etc. So we will, again, be offering stipends for those focus groups, a gift card for your participation. And if you're interested in attending them, I'll stay on for a minute and include these links in the chat box so that you can register or share them with folks that you're meeting with. So finally, we'll again email everything out from today. We have a brief 8-question survey before we wrap up, and we'll continue to host these quarterly town hall events over the upcoming year. So we don't have our next one scheduled yet, but more information will come soon on our next ones. So here's my contact information. I'll also drop my email in the chat afterwards so folks have it, but feel free to reach out to me if you have any questions. I'll stop sharing my screen, and if folks have a minute just to complete the poll before you sign off, that would be wonderful. This also is confidential, anonymous, and just will give us feedback on how to improve these town hall events in the future. And then I included my name and email in the chat. The first focus group, that's for social service and healthcare providers, and then the link to register for the second focus group that's towards community members if folks are interested. Great. It looks like everyone's participated in the poll. I'm going to go ahead and end it. So thank you so much for joining today, and a special thank you again to both our I Am HIP and County Care presenters. This was so wonderful. I know folks probably learned just as much as I did. Thank you everyone for joining today. We hope you have a wonderful rest of your Monday, and we'll see you all soon.
Thank you.